Do you ever get frustrated spoon feeding your baby? It seems like you put the spoon in their mouth and it just rolls to the side and there's never really a place for the spoon to go. Well, I'm Joan Comrie. Today we're going to talk about how to deal with that, and I call it tongue rolling. So you put the spoon in the baby's mouth and it just kind of rolls all over the place. First, I want to say, if you know me well enough or watched enough of my videos, you know that I feel like spoon feeding will optimize your baby's oral function. I have several videos on spoon feeding, so I would encourage you, if you don't think spoon feeding is right for you and your baby, that you look at those videos and see if maybe you can change your mind a little bit. I don't think that you have to use processed baby food. You can just puree your table food. That's what I did with some of my babies, and I think that it doesn't have to be a lengthy process either, but for a lot of babies, to help them transfer their tongue or help them transfer the food, we can call it a bolus, to help them transfer that food bolus optimally to the back so it doesn't get stuck and they gag, spoon feeding is really, really helpful for that. It teaches that tongue tip to elevate, gets the medial tongue to elevate, gets the posterior tongue to elevate. The other thing it does is it helps a baby get what's called central tongue grooving, so that when you place your spoon on the tongue, it has a little cup. And that cup is really important when you're chewing so that you can collect all your food. It's called collecting a cohesive bolus. So you collect all your food on the middle of your tongue before you transport it back. And that way you'll reduce any risk of like gagging and choking and coughing and having anything go the wrong way because your tongue isn't working optimally. Okay, let's get back to what we were going to talk about today, which is the spoon is rolling off your baby's tongue. So of course you know that when you're spoon feeding your baby, you bring the spoon into their visual field so that they can see it. If they don't open their mouth, which is called prehension, so if they don't open their mouth right away, you can tap that top lip or even the bottom lip. I like to do the top lip so that they open their mouth wider, and that way I can put that spoon on that middle of the tongue. Now, I only do that if I know that they can tolerate it. If your baby is only accepting the very front of the spoon or the side of the spoon, they're having some sensory issues that probably needs to be addressed. And so I would keep an eye on that. And if they never accept that spoon on the middle of their tongue, they probably need to come and see a feeding therapist. And the sooner you do that, the easier it is to work through that issue. You don't have to deal with a lot of compensatory issues, and you can alleviate the problem, and hopefully that's the end of it, and then you don't need feeding therapy to help transition to chewing. But early intervention is best, so if you're concerned, find some help or contact me and I'll be happy to help you. So if your baby, you get the whole spoon in their baby's mouth and they just like roll it, they won't let it touch their tongue. Sometimes using a tool called a Zvibe, and that's kind of an expensive therapy tool, so a lot of the families that I work with don't really want to spend that money. So what they can do is buy this little guy called a Hexbug. And it's actually a child's toy. So it's got the bad batteries, so you gotta be really careful. Do not let your child put this in their mouth. But what you do is you turn it on, and if you can hear, or I put it here, ever so slightly, it vibrates. So it's nice and quiet. It's not gonna freak out anybody who has some sensory issues. And you can just get a little like band and attach it to your spoon, and that way your spoon is vibrating. And so when you bring the spoon to your baby's mouth and they allow that to sit on the tongue, it just relaxes their tongue. If you ever had like a lot of the massagers that you get like at Christmas time, those big knotty things, and they massage, well, that relaxes muscles, and your tongue is a muscle. So you can go in and put a little weight on that tongue like you would for an optimal spoon placement, and wait for the baby's top lip to start to work, and then pull that spoon straight out. So this is an easy vibration, is an easy way to provide a little tactile input to the baby's tongue to help them be comfortable with touch on that tongue. Because, like I said, spoon feeding can be optimal because it trains that tongue tip, medial tip, posterior tongue to move backwards. It's called lingual propulsion. So it's basically propelling the food to the back so that the swallow can be initiated. It also helps get that cupping so that you have a place for your food before you start to transport it. So you reduce oral scatter and things all over the baby's mouth, and that just really helps provide good sensory input, helps the motor system, helps your baby's optimal functioning of the oral mechanism for feeding, and that also can help with speech development. So I hope that was helpful. Please, please, please like it, send me a comment, please subscribe so that you don't miss anything. I really appreciate your time. I know how valuable it is. Thank you and have a great day.